Hey everyone, let's talk about something incredibly important that's happening right now. Something that touches every single one of us. Our healthcare system, the very backbone of our well-being, is facing a crisis unlike anything we've seen before. And it's not just about patients, it's about the amazing people who take care of us. Imagine this. More than half of all healthcare workers across the United States are planning to pack their bags and leave their jobs by next year. Yeah, you heard that right. Over 50%. This isn't just a few people deciding to switch careers. It's a massive wave, a real exodus that could shake our hospitals and clinics to their core. We're talking about nurses, doctors, all the frontline heroes who were there for us when we needed them most. This isn't just a statistic. It's a loud alarm bell for everyone in America. So, what's going on? A major national survey, which talked to over 1,500 frontline healthcare employees and hundreds of employers, dropped a bombshell. It found that about 55% of workers are actively looking for new jobs, interviewing, or planning to switch roles in 2026. This isn't just a casual thought, it's a solid intention to move on. Think of it. More than half the people saving lives, comforting families, and working tirelessly are seriously considering quitting. This isn't some isolated incident either. Other recent studies confirm this widespread desire to leave, with anywhere from one-third to half of these essential workers eyeing the exit. Hospitals and clinics are already struggling big time. They're dealing with constant turnover, exhausted staff, and an aging population that needs more and more complex care. These challenges have been building up, but now staffing shortages are becoming the new normal. Imagine your local hospital, already stretched thin. Now, picture half its staff walking out the door. That creates enormous pressure on the entire system, leading to even longer wait times, less personalized care, and a dangerous cycle of more burnout for the workers that remain. We rely on these incredible professionals for everything, from emergencies to routine checkups, and the system is under incredible strain. Experts who've been in the field for over 40 years are saying it's worse than it's ever been. They're seeing more staff leaving than ever before, with jobs getting harder and patients needing more specialized attention. This isn't just a problem for hospitals, it's a problem for every American who might need medical care in the future. The sheer scale of this crisis is unprecedented. What could possibly be driving such a massive wave of departures? Stay tuned, because the reasons are even more eye-opening. Why are so many healthcare workers ready to leave? It's a mix of powerful factors, and many of them started brewing during the pandemic. As one expert put it, the pandemic was like pouring gasoline on a fire that was already smoldering, the fire of burnout. During those incredibly tough times, healthcare workers faced new, intense stressors. They were told to just keep your head down and keep going at all costs, with no real break or respite since the pandemic began. It's been a non-stop marathon, and frankly, they're exhausted. Data from the Centers for Disease Control and Prevention confirms a growing mental health crisis among these vital workers. For many, this has become a breaking point. But it's not just the sheer exhaustion. This recent survey revealed some truly heartbreaking truths about how our healthcare heroes feel. Get this, a staggering 84% of healthcare workers said they feel underappreciated at their current employer. Think about that. Almost everyone on the front lines feels taken for granted. Only a small fraction, less than one-third, feel truly valued or loyal to their employers. That's a massive disconnect. And here's another kicker. Only 1 in 5 healthcare workers believe their employer is actually invested in their long-term career growth. Just 20% think their bosses care about their future. Imagine working in a field where you constantly need to learn and grow, but your employer doesn't seem to care about your progress. Half of the people surveyed specifically pointed to a lack of growth opportunities as a reason they're planning their exit. This is especially true for younger workers like Gen Z and millennials, who are even more likely to be looking for new jobs and value educational benefits. These brave men and women are facing harder jobs, with patients who are older and sicker requiring more intense care. Plus, there's a disturbing trend of increasing violence against healthcare workers. They're working in environments where they don't feel safe, they don't feel supported, and they don't see a future for themselves. It's a perfect storm of pressure, lack of appreciation, and a feeling of being completely used up. This isn't just burnout. This is a profound sense of disillusionment. But what happens if this trend continues? And what can be done to stop it? We'll tackle those big questions next. So, what does it mean for all of us if half of our healthcare workforce is ready to walk away? The implications are huge, and they touch every American family. We're already staring down a projected shortage of nearly 700,000 physicians, registered nurses, and licensed practical nurses by the year 2037. And that's just a starting point. The real number could be even higher when you factor in all the other critical roles in hospitals and health systems. This isn't some distant problem either. Our population is getting older fast. The number of Americans aged 65 and up recently grew at its fastest pace in 130 years. An older population means more people needing more complex care, which puts even more stress on a shrinking workforce. It's a dangerous cycle. More patients, fewer caregivers. This is a critical juncture for healthcare in America. But here's the good news. This isn't a problem without solutions. The survey findings actually offer some clear insights into how hospitals and healthcare systems can keep their amazing people. It all comes down to proactively investing in their employees. First up, education and career advancement. Remember how half the workers said a lack of growth opportunities was pushing them out? Well, the flip side is true too. A really surprising finding from the study was just how big a role opportunities for continuing education and career advancement play in keeping patient-facing healthcare workers where they're needed most, at the bedside. Over 60% of workers surveyed said they would be much more likely to stay at their jobs if their employers offered tuition assistance. This means providing programs for leadership training, helping them get professional certifications, and making sure they're up to speed on the latest medical tech, AI, and clinical research. It's about showing them a future, not just a job. Second, and just as crucial, workplace safety. The rising violence against healthcare workers is unacceptable. Hospitals need to step up and establish zero-tolerance policies for any hostility toward their staff. That means stronger security controls and making sure departments and waiting rooms are properly staffed, especially during busy times. When workers feel safe and supported, they can focus on what they do best, healing people. And finally, it's about plain old appreciation. When 84% of your team feels taken for granted, something needs to change. Small gestures, recognition programs, and simply listening to their concerns can make a huge difference. This isn't just about morale. It's about retaining the vital talent that holds our healthcare system together. The choices we make now as a society and within healthcare organizations will determine the health and stability of our nation's healthcare for decades to come. This is a challenge, yes, but it's also a massive opportunity to rebuild and reinforce a system that truly values its heroes. All right, that's a lot to think about, isn't it? Our healthcare workers are at a breaking point, but we also have clear paths forward to support them and strengthen our system. Let's make sure their voices are heard and that we push for these vital changes. If you found this information eye-opening and valuable, please do me a huge favor. Hit that like button. It really helps this message reach more people. And if you want to stay informed on topics that truly impact your life and your finances, make sure to subscribe to the channel and ring that notification bell so you never miss an update. Thanks so much for watching, and I'll catch you in the next one.